Oh my gosh, my gastric pouch feels like it's stretched out. What do I do now? My name is John Pilcher. I'm a bariatric surgeon in San Antonio, and people come to me with these concerns very often. It's appropriate. It's a serious thing. It's kind of like a nightmare, right? Because most patients have been through a time period, 6 months, 2 years, 10 years after their surgery, where the surgery was working great. They had things under control, and now things are creeping back out of control. And it can be reminiscent of those diets that you've been on, where you lost weight for a little while, and now the weight's coming back. And you can feel like, oh, I'm failing again. Or maybe the surgery's failing me. It's hard to know. And the good news is that we have a plan for this situation. It's probably not going to involve revision surgery. It is going to involve some work, but there are clear ways forward to get the situation back under control. And probably every single bariatric surgery patient since the beginning of bariatric surgery has experienced a problem like this at one point or another. And if you are in this situation at this time, the first thing to do is make a call to your bariatric team and say, hey, I need some help. And the team is there to help. There's not going to be judgment. There's not going to be blame. There's going to be assessment and some guidelines for helping you get back on track. In the meantime, though, I think I can give you some information that will help you understand why your pouch may be changing and how to help it and your metabolism get back into a place where it's working with you to help keep the weight and metabolism in a healthy balance. Today I'm going to use this term gastric pouch a lot, and so I want to use some diagrams to make sure that we're on the same page when we use this word. And this applies to both sleeve and gastric bypass. For the gastric sleeve, we're talking about this skinny section of stomach right here. And when surgeons are doing the operation, what they're trying to do is make this section of stomach as skinny as we can without causing new problems like kinking or folding or blocking. We're removing a large section of the stomach on this side, but what we really are doing is measuring what we keep, and again, we're trying to make it fairly slender. Now, the term sleeve can be confusing sometimes because people ask, okay, are we putting something in there, or are we wrapping the stomach? But no, we're not placing anything inside the stomach. The word sleeve was just the word that the originating surgeons wanted to use to signify kind of a narrow, skinny tube of stomach. Okay, so that's the gastric sleeve, gastric pouch. And in the gastric bypass, the gastric pouch is this section here. And this gastric pouch is also fairly small, and this is meant to be just big enough to be able to attach a piece of intestine safely onto it. And so although these stomach pouches for the sleeve and the gastric bypass are technically different sizes, in both cases we're making a stomach pouch that's as small as we think we can and have it function properly after the surgery, meaning that you can eat normal amounts of solid, healthy food. It's really important to know that this little stomach pouch is formed from natural living gastric tissue. And natural living gastric tissue has some natural stretchiness to it. If we don't think about it carefully, and if you're not a surgeon who's working with this regularly, you might conceptualize your stomach pouch like a container. You know, it could be plastic, it could be metal. You might think with sort of a Tupperware idea. You know, is my stomach pouch this size, 4 ounces? Is it this size, 2 cups? Is it this size? Oh my gosh, I hope not. You know, that would be a bit too big, even in the context of this video. But it's not a rigid container, it's flexible. And so if we think about normal stomach, you know, before bariatric surgery, we all have these normal stretchy stomachs, and that's what allows us to go, you know, back always for a little bit more at Thanksgiving. You know, it's so good, I want to have seconds or thirds, and now it's time for dessert. And there's always room for some more, and that's what a stretchy stomach does for you. And that normal stretchy stomach is also what lets people do crazy feats of eating, like these, you know, hot dog eating contests. This is natural and normal. So when we say that natural healthy stomach has some stretchiness, it's not like a container, like this Tupperware. It's a little bit like a kid's balloon, okay? And we're going to pick, let me see, one of these red ones for stomach. And you can imagine before I even blow it up that this balloon is stretchy, okay? And it's got a certain size. And it can be quite a bit bigger temporarily, and then when the pressure is off, it shrinks back to its normal tiny size. And this is kind of what stomach does. Now, stomach doesn't stretch quite this much, but it can stretch to 3 or 4 times its resting size. And that's going to be true when we talk about preoperative from bariatric surgery, and it's going to also be true after bariatric surgery when we talk about your healthy, mature, well-healed gastric pouch. Now, the next important thing about this natural living stomach tissue is that it responds to what's done to it. So when we do your surgery, when your surgeon is in there working and stapling and grasping and cutting, your surgeon is putting some necessary, natural, expected trauma on your stomach. And the stomach after the surgery will be sort of like bruised or swollen. And so for a while, and I mean like actually for several months, the stomach is not going to have the natural stretchiness of the kid's balloon. It's going to be more like an old-fashioned hot water bottle. It'll have a little bit of flexibility, but very limited flexibility. So when your surgeon makes it a very small, appropriate size, it's going to feel really small and really tight. And what will happen with that is that when you're eating food in the first couple of months after your bariatric operation, because your stomach is temporarily very stiff, when you eat and you get full, you're going to feel full and really feel like you're running into a wall with your food. Now, the natural stiffness and the very small food capacity is actually kind of a cool feature that helps jumpstart the weight loss. You can actually be full with an ounce or less of food. And at the same time, the powerful metabolic impact of the operation is the most potent at the beginning of the process, so the pounds fall off and your sense of well-being increases and you feel like the queen, or maybe the king, of weight loss. And we call this the honeymoon period. It lasts for several months after the bariatric surgery. But then something happens that can be scary, and that's the topic of this video, which is that when the healing goes along over 3 months or 6 months or 9 months after the surgery, the tissue gradually softens and it regains its natural stretchiness. And so for some people, this is a change that happens over a few weeks or a few months. For other people, it seems like it happens overnight, but it's natural and expected that a time will come when you feel like you can eat much more food. Now, if you were having the habit of just depending on your bariatric operation to make you stop eating, you know, that stiffness and that really dense, hard sense of fullness, then you're going to be in trouble at this point, because that feeling of making you stop eating is going to go away, and now there's always room for a little bit more. It's still not as big as it was when you had your natural stomach before the bariatric operation, but it's different and it's a larger capacity. And as we're going to talk about, the key thing is not can you eat that extra food, but the question is, do you need that extra food? But here we are today. Right now, you've been eating an ounce or two of food, and now all of a sudden you can eat not just the insides of the sandwich, but the bread of the sandwich as well. And let it go that you're not supposed to eat the bread of the sandwich anyway, but that can be a panic situation, and hunger can start coming back, and you can start feeling like things are broken. This sense of opening or relaxing of the stomach is natural and expected. It's also completely unavoidable, and I'm going to teach you how it's actually kind of a good thing that helps you eat healthy, natural food over time. So just remember, I used the comparison a minute ago about the natural stomach tissue being like a kid's balloon, being very stretchy. And we said that for a little while after the surgery, for a few months, the stomach is kind of swollen and stiff. But then as the months pass, it gets back its natural stretchiness. So again, we have a little kid's balloon. This is a smaller one because this is your bariatric pouch. And it can expand to be much larger than it would be when it's empty. But again, that expansion is natural. There's no damage. And in fact, that process of stretching has some nerve sensations that will cause you to feel that food in your stomach pouch. And again, not damage, just a stretching sensation, and to feel satisfaction. And I want to teach you to use that sensation to be satisfied and to stop eating at that point, even though you could expand the balloon much bigger than that initial stretch. Of course, the pioneering bariatric surgeons saw this issue in their patients as well. The patients were concerned because everyone thought that keeping food capacity to a minimum was key. The bariatric surgeons had that instinct, but they went ahead and they studied the process and they did research projects. And almost in a surprising way, they found that, number one, all patients had increasing food capacity over the first 2 or 3 years after their surgery. And number two, here's the key thing, that the increasing food capacity did not correlate with weight regain over time. Let me emphasize that point. The research studies, which have been repeated multiple times over time, have shown that patients can have a wide variety of gastric pouch food capacity levels and still have excellent weight loss results. And to say it in a different way, people can regain weight with a tiny little stomach pouch and with very little food capacity. We're going to explore this more as we go along. But first let me talk about one of the particular studies. So Dr. Latham Flanagan from Eugene, Oregon was one of these pioneer surgeons. And he did a really cool series of tests for all of his gastric bypass patients. This was in the 90s, so it was only gastric bypass back at that time. And he published this paper in 1996, and he described what he called the cottage cheese test. And he would have patients at home, in the comfort of their own home, do this test where they would use cottage cheese to get kind of a sense of a functional capacity of their stomach pouch. And I'll describe the cottage cheese test a little bit later in the video. But suffice it for now to say that what he found, like I mentioned, was that over the first 2 and 3 years, all of his patients had gradually increasing food capacity as measured by the cottage cheese test. And he also found that his patient population had dramatically varying pouch sizes based on the cottage cheese test, but that the cottage cheese test did not predict any difference in weight loss results. Okay, and just to emphasize this one more time, different food capacity does not correlate with different success in weight control or metabolic health. And I'm going to put up a couple of graphs from Dr. Flanagan's 1996 paper. The first graph shows the progression of increasing food capacity over the first 2 to 3 years. The second graph shows a wide variety of food capacity among Dr. Flanagan's patients, and it also shows that all of these food capacity ranges, ranging from 3 ounces up to 9 ounces of food capacity, had excellent weight loss results on average. When I'm talking to my patients, I like to let them know that their food capacity is going to increase to what I call small normal. This means something like a second grader would eat. It's normal, healthy food. It doesn't require special preparation. Some days you eat big, some days you eat small. You want to eat the quality food first. And I'm going to return to the topic of how this small normal food capacity is the right way to have metabolic health and maintenance over time. But I want to change gears a little bit into some techniques for assessing the gastric pouch capacity, because if you're watching this video, that's probably what you want to know. I'm going to talk about two tests that your medical team can use, and then I'm going to describe the cottage cheese test that you might use at home, although I want you to take that with a grain of salt. So your bariatric team or your gastroenterologist can do a couple of tests that are good at looking at the gastric pouch. The first test is called upper endoscopy. And upper endoscopy is typically done with light IV anesthesia. Many of you may have already had an upper scope if you've already had a bariatric operation. And the surgeon or the GI doctor will use a scope, a flexible scope with a light and a TV camera to go and look inside your stomach pouch. Now, part of the scope is that we use air pressure to actually inflate the stomach pouch. That helps us see everything, but it also gives us kind of a gentle expansion of the stomach pouch so that we can measure the stomach pouch. And the scope has reference point markers so that we actually can get a numerical measurement of your stomach pouch. That's probably the most common technique that's used to measure pouch size. The second technique, and what I actually like a little bit better for my own purposes, is called an upper GI X-ray. And this is typically done at a radiology center. It doesn't involve any anesthesia. And under the fluoroscope, which is the X-ray device, the team is going to have you drink some lovely chalky liquid that's called barium. This barium shows up on X-ray so that when you drink it, and the X-ray is used to look at your bariatric anatomy, the barium is going to fill up your bariatric anatomy and let us take pictures from the front, from the side, from different angles, and make reference points with, for example, your spine, which has a fixed size, and we can also use that to make very good measurements of your stomach pouch. And I'll tell you about the cottage cheese test in a minute, but just for your knowledge, I'll tell you that these days, most often, either one of these tests, the endoscopy or the upper GI X-ray, comes back normal. Normal meaning not only that you have a small, appropriate stomach pouch, but also showing that you don't have complications like an ulcer or a blockage or a twist. Now, when I'm talking to patients about normal findings on the endoscopy or the upper GI X-ray, they say, oh my God, I can eat so much food, or I can eat any type of food, including the wrong foods. How can my gastric pouch be normal? I'm going to come back to that. But first, let me go into the cottage cheese test so that you can kind of check yourself at home. Now, again, please take this with a grain of salt, because this isn't something that you've practiced with. You're not doing it with direct coaching. So there's a couple different ways to get funky results. But let's walk through it. And I think most often you're going to find this to be reassuring. It may also be something that you want to use in your own journey over time to check, every 6 months or so and see where you are. So here's how it works. First thing in the morning, before you drink or eat anything, you want to start with a fresh container of cottage cheese. Take the lid off. And you're going to give yourself no more than 5 minutes. It might be 2 or 3 minutes, and a spoon. And you're going to eat pretty briskly until you begin to feel a sense of fullness. Now, I don't want you to go till stuffed. That's one of the ways that you can kind of mess up your test results. But the beginnings of a sense of fullness. And when you reach that point, you stop, and you're going to have a gap in your container of cottage cheese. And now what you want to do is you want to take a measured volume of water, let's say maybe use 10 ounces, and you're going to pour that in until the water in the cottage cheese container reaches the level where the cottage cheese began. And however much you poured in there, let's say it's 4 ounces or 6 ounces, however much you needed to pour in to get back to that level is the cottage cheese test size, or the functional size of your gastric pouch. Now we'll go back to the question of, I feel like my pouch is so stretched out, how can the test result be normal? And of course, everybody's heard of people that stretch out their gastric pouch. And back in the early days of bariatric surgery, that did happen with some regularity. It took a few years for bariatric surgeons to figure out the best way to form the gastric pouch. And so you'll notice from the diagrams that both the gastric bypass and the gastric sleeve have formed the stomach pouch on what's called the lesser curve of the stomach, which is the least stretchy part of the stomach. And we found over time that a stomach formed from that section, the lesser curve, tends to be stable over months and years after the operation, at least in terms of the testing and the resting volume. Remember, this is stretchy stomach, and so when you eat food, it can become quite large. The other thing that can happen is, and it's normal for it to happen, is that the stomach and, in the case of the gastric bypass, the intestine become more and more efficient at carrying the food downstream. So even as you are eating, the food is moving downstream and beginning the digestive process. That's normal. Also, when I've talked to patients in detail, very often a sense of hunger or a craving or a sense of hunger coming back after you eat is sometimes confused with the gastric pouch that gets stretched out. And these are actually different things. The craving comes from a metabolic imbalance, and this just opens up the fact that it's a complex discussion, and this is why, if you're struggling, you need to sit down with your bariatric team, and this video is just kind of a starter set of information. I've been telling you repeatedly that meal volume and gastric pouch size are not the key indicators of weight loss, at least within certain limits, because again, you don't want this gastric pouch. Okay, we want moderate meal size, but you don't need tight restriction. You may still be skeptical because the intuition that restriction is important for weight loss is nearly universal. And in fact, if you have that intuition still, you're in good company. Bariatric researchers keep coming back to this idea. And so I just want to walk down several examples of restrictive approaches to weight loss that have not worked, just so that you know that these things really have been tried. And these are different examples of why restriction alone is not the key. So at the beginning of this whole process, bariatric surgeons, or actually it was ENT doctors, actually tried wiring the jaw shut. They figured, well, if you can't eat as much, then you would lose weight. And yes, you lose weight temporarily. In a few months, it fails. Surgeons tried putting different surgical materials around the upper part of the stomach to sort of constrict or to choke off the stomach to some degree. It failed. Surgeons stapled the stomach into a certain little narrow pouch with a band outlet. That was the vertical banded gastroplasty, the first thing that was called stomach stapling. It failed. Companies came up with, okay, well, if these fixed bands don't work, maybe an adjustable band, the lap band. It failed. What about the gastric bypass? If people gain weight back, shouldn't we put a ring around the outlet of the gastric bypass? That was done a lot, and that failed. Back to the lap band. Okay, the lap band alone doesn't work. What if we put a lap band on top of the gastric bypass? That's been done, and that fails. What if we just fill up the space in the stomach with balloons, and then people can't eat as much? And that fails. I myself did an experiment back in 2002 that unintentionally confirmed this point. Back at that time, we were having problems sometimes with this little circular connection scarring down and requiring our patients to come back into the hospital for corrective procedures to open it up a little bit. We had traditionally been using a circular stapler that was a 21 size. There was one available that was a 25 size, and so I decided to randomize. I did 50-50, using some 21 and some 25 to find out if we could get rid of this problem of patients having to come back in the hospital with a narrowing or a stricture. And in fact, it did get rid of the problem. The 25 patients almost never had to come back in the hospital, and so I implemented the 25 circular stapler, at least for a number of years, until surgical techniques moved even further. The interesting thing was that the 25 patients, the larger connection, they lost weight better than the 21 patients. So what's going on here? we've been saying that restriction is not the main thing. And if restriction isn't helpful, well, what do we have? And I guess I would say that it's not that restriction is unimportant, and we actually still believe that a moderate degree of restriction is still helpful. You know, we want you to have kind of a smallish normal stomach pouch. Maybe it'll hold this much, and again, but it needs to be thought of as a stretchy thing, okay, not a fixed container. So we agree that some moderate degree of restriction and kind of small normal eating is appropriate, but I'd like for you to think of that as the tip of the iceberg, and the big part of the iceberg is the metabolism. And the cool thing is that the gastric bypass and the sleeve do affect the metabolism. These other procedures that I've been talking about missed that whole idea. And so they blocked people's ability to eat, but they did not fix the hunger. And if you don't fix the hunger, then even motivated, well-informed people are going to end up eating around the surgery. They're going to eat foods that are highly lubricated, or they're going to be liquid calories. And not only are these liquid calories and highly lubricated, and they go through very easily, but also they tend to be carbs, which further worsens the metabolic situation. It makes the metabolism get further out of balance, and hunger increases. And so it turns into a vicious cycle. And in this way, restriction, like my 21 circular stapler patients, can actually have worse eating behaviors and worse hunger because the surgery is too tight or too small. That turns out to be the key to the situation. So as I've been saying, the right question to ask with the gastric pouch size is not how much can I hold, but instead, how much do I need to feel satisfied? Just because you can eat a large volume of food, or because you can eat a wide variety of foods, including things that you shouldn't eat, doesn't mean that you need to do those things. And if you have been having some behaviors of large volume eating, or feeling cravings shortly after you eat, or feeling pressure to eat different bad types of food, that's probably caused by an abnormality in your metabolism, an imbalance in your metabolism, rather than a lack of restriction with your food. Again, we want you to be able to eat small, normal amounts of food, such as chicken or salad. It needs to be healthy, solid food, and not sliders and not liquid calories. Now, I've put together several other videos on what the right types of food are and how to maintain a healthy metabolic balance. I had in mind I would link from this video to those other videos, but it turns out that I need 1,000 subscribers before I can do that. And so I'm just going to point you to those other videos. The one is called A Practical Guide to Healthy Eating, and the other one is called The Pillars of Metabolic Health. But I am going to give you a few pointers here. And before I get into the few pointers, I'm going to give you sort of a checklist for potential problem areas. Problem area number 1, the wrong type of foods. If you're eating salty snacks like Doritos, or if you're eating lots of sugar or carbs, or if your food has chemicals, and I mean preservatives and artificial sweeteners, then the food is going to tend to stimulate more hunger. And so wrong type of food leads to more cravings and leads to an increase in the amount of food that you eat. That's one path to weight regain. Number 2, liquid calories. So alcohol is a huge problem. Smoothies, protein drinks, milkshakes, all these things will flow right through your stomach pouch. You'll have no sense of satisfaction. They'll be absorbed overly rapidly before your body can handle them appropriately. They'll cause your blood sugar to bounce around, and again, that will disrupt your metabolic situation. Problem area number 3, turning your food into liquid. So even if you're eating healthy food, let's again say chicken or salad, if you're having a bite of chicken and then some water and some salad and some water, you're turning your food into soup, and it will flow downstream too soon. It will be reabsorbed too rapidly. That's a metabolic disruption, and you'll lose the gentle sense of fullness as well as having blood sugar fluctuations. So you need to not drink with your foods. The next thing is what I call forced eating. People are so paranoid about protein levels these days. It's very common for me to hear, well, I'm eating to make sure I get enough protein. And I want you to be protein focused. We like protein, but we find that when people eat extra and kind of override their hunger level, then they can train their stomach to handle bigger volumes, and they never get a chance to kind of notice what hunger is supposed to feel like. Lack of vitamins is problem area number 4. And if you're lacking vitamins, then that can slow down your metabolism and it can cause cravings. Problem area number 5, many prescription medicines can cause excess hunger, or they can slow down your metabolism. Common prescription medicines that can be a problem would include most antidepressants, steroids, some blood pressure medicines, and this is a good place for you to come into the bariatric team for review. And then lack of exercise is another problem area because it interferes with your metabolism. Throughout this video, I've been de-emphasizing the sense of restriction that people need to have success with their weight control in the long run, but still, it's nice for your stomach pouch to give you a nice sense of satisfaction when you eat the right types of food. So how is it that you can achieve a happy, healthy pouch? I'm going to give you a couple tips on that as well. The first thing is you want to separate your fluids and your food. I want you to hydrate, and I want you to hydrate right up until you eat. In fact, it can be useful to drink a glass of water right before you eat because that will make sure you're hydrated and put a gentle stretch on your pouch so that it takes the edge off your hunger and you can eat more under control. Number 2, eat solid, healthy foods. Again, chicken, salad, seafood, beef. All the green vegetables are excellent. Many fats are okay, can be healthy, and proteins, of course, are a nice choice, but again, not protein obsessed. Number 3, slow down. Here's a tricky thing. The little nerves that sense the pouch stretch, they function slowly. And so what you'd like to do is you'd like your meal to take between 20 and 30 minutes. You don't want to eat routinely on a 5 to 10 minute basis because your stomach pouch doesn't get a chance to tell you when it's full, and you will very commonly overeat by eating too fast. By the same token, don't take 30 minutes to eat because, like I mentioned, the food is transiting out of your pouch even while you're eating, and you don't want to get into that thing because that's not necessary for satisfaction. Speaking of satisfaction, I want you to stop eating when you're satisfied, not when you're full. And when you have a healthy pouch, then you are going to have room for a little bit more or a little bit more. But recognize that all you need to do is take care of your hunger. And so the first part of this point is you have to wait until you're hungry to begin eating. And then notice how much does it take to take care of the hunger. And that would be the great stopping point. So you'll stop when you feel satisfied, even knowing that you could take a few more bites, but you don't need to. The cool thing is that even today, if you feel like you have a broken pouch or a stretched pouch, if you use these habits for an extended time period, you can kind of reset or retrain your pouch so that it will feel smaller and give you a much better sense of satisfaction. A quick review on the key points for keeping a healthy, happy metabolism as well. This is going to be very brief because these are covered extensively in my other 30-minute videos. But first of all, as I've mentioned a couple of times already, eat solid, natural food, low carbs, and stay away from chemicals like preservatives and artificial sweeteners. Take your vitamins. If you're missing your vitamins, you're going to have cravings. Exercise regularly, at least 4 times a week. Cardio is fine, but you want to add in some strength training. Now, last of all, I just want to remind you that if you're in distress, if you feel like you're not in control, you aren't alone. Call your bariatric team. They're there to help, and they can help. The road may not be easy. There's not a certain stopping point. It's always going to be work, but we are here to help.